the government just shut down at midnight last night, and I've already gotten texts and emails from people asking, is my Medicare going away? Will I still get my benefits? So let's set the record straight, because there's a lot of misinformation going around, and the last thing you need to do is stress about your health care. Here's the good news. Your Medicare benefits are safe for the most part. They don't stop. Medicare is what's called mandatory spending, which means it doesn't depend on Congress passing a new funding bill every year. So if you're on Medicare, your doctor's visits, hospital stays, and prescriptions are all still covered. Payments to doctors, pharmacies, and hospitals keep going out too. But there are a couple of important exceptions in this late 2025 shutdown. Many of the special telehealth rules from the COVID era just expired because Congress didn't extend them. So this means Medicare telehealth is mostly back to rural-only coverage. For most non-mental health visits, your home doesn't count anymore, so you may need to go to a clinic. And certain providers, like physical and occupational therapists, can't bill Medicare for telehealth right now. And the acute hospital care at home program also lost its waiver. So CMS has told hospitals they need to either discharge or move patients back into traditional hospitals unless Congress brings back the program. So yes, your core Medicare benefits are still there. But if you rely on telehealth or hospital at home, you may be seeing real disruptions right now, and almost half of staff at CMS and HHS are furloughed. So if you call Medicare or CMS, you should definitely expect longer hold times. Yes, the phones are still open. The Social Security Administration, which issues Medicare cards, paused card replacements. You'll still get your benefits, but if you lose your Medicare card, you'll have to wait until the government reopens to get a new one. Even with the government shutdown, here's what's still running. Medicare and Medicaid payments are still going out. Contractors who process claims are still working. If you're under 65, the ACA marketplace is running on carryover funds. States are still receiving Medicaid and CHIP payments, so the system's not completely shutting down on you just yet. But what if this shutdown drags on for months? Well, if the shutdown lasts longer than 3 months, I think we're in big trouble, but certain things like policy making, rule updates, and contractor oversight could all start feeling the strain. But historically, shutdowns don't last that long. Here's what you can do right now to protect yourself. If you're already on Medicare, I think it's safe to say that you can relax. Your core benefits are safe, just expect slower mail and longer hold times. If you're enrolling soon, get your paperwork in early to avoid any delays. If you're switching plans, work with a broker like me to make sure it's done right the first time. Need your Medicare card? Download a digital copy and keep it handy. So here's the bottom line. No, Medicare is not going away. No, your Advantage or supplement plan isn't stopping. Yes, you can still go to the doctor and pharmacy like normal. The biggest changes from the government shutdown right now are telehealth rollbacks, the end of hospital at home, delays in Medicare card replacements, and slower service from CMS. I'm Callie Navrides, a licensed insurance broker, and I help people with Medicare every single day. And if you've got questions about how this shutdown affects you personally, give me a call or schedule an appointment. The info's in the description below. And I want to hear from you. If you notice longer hold times, mail delays, or issues with telehealth since the shutdown started, drop a comment below. Maybe you can connect with others dealing with the same issues. And if you found this video helpful, make sure to hit that like button and subscribe to the channel so you don't miss out on my Medicare updates. And before you go, click right here to watch this next video with more Medicare insights like this. Thanks so much for watching, and I'll see y'all in the next video.